It said we're all set.
Yes, welcome everyone. Today we have privilege of speaking with Dr. Willis from Clinique Les Alpes, one of the Switzerland's leading mental health and addiction recovery centers. With a unique holistic approach, Clinique Les Alpes provides comprehensive treatment programs for addiction, executive burnout, and mental health challenges. Dr. Willis, thank you for joining us. There are many concerns and questions about mental health recovery, rehabilitation therapies, and effectiveness of different treatment approaches. I have collected some of the most frequently asked questions from patients and families worldwide. Before we begin, could you please introduce yourself and share a bit about your background?
With pleasure. So my name is Randolph Willis. I'm of United States, North American origin from Ann Arbor, Michigan, but I've been living in Europe and mainly Switzerland for the past 42 years. I came here when I was 20, just wanting to discover Europe and the world in general, and I ended up staying in Switzerland, where I've been practicing psychiatry for 32 years now. Um, I started working a lot with the asset of the English language that I possessed in this French-speaking part of the country of Switzerland, where there's 100,000 English-speaking people approximately around Lake Geneva, according to recent statistics that I've looked into. So that's a lot of people that aren't doing well already here. If you look at the statistics for anxiety, which is 40 to 60% of the population, same thing for depression. 1% for bipolar disorder, 1% for schizophrenia, and then many other different types of disorders. So that's a lot of work. And people that just from the local area could come in to Cliniques Les Alpes for treatment. So I've been doing that for quite a few years, and I came here as medical director 7 years ago, and I've been working with the team here. In my outpatient work that I did previously, I've been appointed president of the French-speaking part of the Swiss Hypnosis Institute. So I organize, independent of the clinic, I do organization for meetings and medical meetings and research concerning hypnosis. I was also in a psychoanalytically inspired relaxation association. I was president of that association for many years, where it's different types of body mediation therapies, but concerning the psychoanalytical approach. I've done extensive training in systemic and family therapy. One thing that led me to addictions that I afterwards did some specialization in, but it's mainly work that I've accomplished just with the many years of experience, is that the English-speaking population that does not speak French, not being able to express themselves, frustration comes in, and there are very many different types of, let's say, psychosomatic disorders. And included in that is substance abuse and behavioral addictions, where people not able to express themselves, they express themselves through suffering, and which is very often depression, anxiety, different types of addictions, be they chemical or behavioral. So I've been working with that for quite a while, and now for 7 years here at Clinique Les Alpes with my team.
Perfect. So let's start from first question. What makes Clinique Les Alpes different from other rehabilitation centers?
Okay, I've seen quite a few, and I've worked in others in the past. And one thing that I can say that's different at Clinique Les Alpes is the most important also is that we are public health certified. So we're like a hospital. We're not just a medicalized hotel or some villa that's rented by some institution, some group that says we're a clinic and sets up a team. We're a team that's been mainly working together with a solid backbone of the same philosophy for 7 years now. So that does differ us from other clinics. The others, of course, were very high end. So we take care of people from a certain level of society that perhaps don't want to go to other clinics. You can't have celebrities mixing with other people that might cause problems if they see someone famous in front of them. Here, there's no problem with that. Everyone's more or less used to that, patients and team included, of course. So that's what makes us very different. Another thing that I could say is very different from other, let's say, spas where people can get detoxed or treatment, is that the real detox, if it's serious for alcohol, opiates, other types of drugs, is done medically. We have two secured acute rooms where we do a full medical detox. So you could say this place is a one-stop shop. We're not going to send you off to get detoxed in some somatic hospital in the region and then come back when you're sober enough to start doing treatment. We do everything here from A to Z.
Perfect. What are the most common mental health conditions and addictions you treat?
I would say let's say the majority of the patients coming in, they have a problem with alcohol, but often with comorbidities, that is depression, anxiety, and other problems that we take care of. Otherwise, with all the other affections, I could say depression and anxiety are the psychiatric with no dependency comorbidities. I'd say those are the most we see here, depression and anxiety. And then there's the rare eating disorder, post-traumatic stress disorder, sometimes psychosis, but it has to be stabilized where it's a calm situation. We want a calm situation to be reigning here at the clinic, of course. That's why I filter myself and my colleague. We have an initial assessment to see what the level of, let's say, how complicated the symptomatology is that the patient's presenting, so they don't disrupt the calm that reigns here at the clinic usually. We also we take care of all types of chemical addictions, alcohol and illicit, prescribed and illicit drugs, and then all the behavioral disorders. We take care of anything that you can imagine you can addicted to, like screen addiction, gambling, sex addiction, love addiction, pornography addiction. We see certain eating disorders like obesity and other types as a food addiction, where there's control and other elements of addiction that are implicated in that symptomatology that make it treatable like an addiction that works rather well here at our clinic. And then there's sometimes people that just come in, we'll talk about this later, I saw your other questions, for just general checkup to see if there is anything wrong, for burnout and other problems, obesity, et cetera, that we'll talk about in your later questions.
Perfect. Could you share real success stories of patients who have recovered in order to motivate people that still they have chance?
Sure. Of course, we have medical confidentiality and medical secrecy. We can't give anything that would let the patient say, oh, they're talking about me. But I can tell you that we have had patients that were extremely well-to-do, but for them, their money, their fame was worth nothing because they had lost everything because of addiction or the symptomatology of depression that can make you think that even though things are fine around you, you have the delusional, contrary to reality belief that the world is over and that there's nothing left to do but in your life, or at least just not doing anything significant with your life anymore and abandon your career because you're a bad person. So we've had people coming in very, very dire situations, be it psychiatric or somatic, that is physical, and we've turned them completely around and they've gotten back to their work, their families, their pastimes without the pathology. They're very happy. We have patients that come back and do testimonies to show what it's like to be free of mental illness or substance abuse. And that sharing is something that gives the patients a light at the tunnel and that reinforces their own recovery.
Perfect. How does the executive burnout program help professionals regain balance?
Okay, I saw your other questions concerning burnout. Perhaps I should respond to those first. So for me, burnout is in the 11th version of the International Classification of Mental Illnesses, but it's more a euphemism for depression. It's depression, but a specific type of depression where a patient has used up all their reserves, they have no energy, they feel tired, they have cognitive difficulties like memory loss, difficulties concentrating, difficulty sleeping. And the main thing is that it indicates that they can no longer be performant at work or in their roles in society or with family. And what we do is, it's a 2-week program that we have here, is that we first of all do a full psychiatric assessment, of course, to see if there's not something underlying that might be perhaps depression that needs antidepressant medication, or at least non-medicinal treatment for depression, like our body mediation approaches. We have approximately 25 different types of complementary approaches that I've verified are evidence-based effective to help patients lower the intensity of depression, anxiety, craving for substance abuse, the symptoms of withdrawal, etc. So with this program, we have them first assessed, and then we get them very quickly into a streamlined program to lower the symptoms of burnout and get their energy back. And then we have life coaches and our counselors, our therapists, that go through their lifestyle with them to see what can be changed to avoid, again, burning the candle at both ends so they can function adequately and get back to work again. Sometimes we do propose negotiations with the company they work in or the situation where they're being burned out in to have a break from that for several months to be able to get back into shape, to recuperate and rejuvenate, and then function much more efficiently in an environment that we have coached them to make less stressful.
Good. What specific therapies do you offer that set you apart from other clinics?
Okay, just to cite, first of all, we have all the basic therapies that all clinics do. That is, for addictions, our main model is the 12-step model of Alcoholics Anonymous. Excuse me, my voice is a little rough yet still with this cold. The Hazelton method from the Minnesota school, where it is the 12-step method, but also where we can use psychiatric medications and psychotherapeutic techniques to help patients when simple AA is not sufficient. If patients say, no, been there, done that, don't want that, we use motivational interviewing techniques, other types of CBT and DBT techniques, dialectic behavioral therapy. And then we use the basic psychotherapies that are used in general psychiatry, such as psychoanalytical approaches, CBT, DBT, and family therapy. That is systemic therapy. So those are the main ones that we do that other places do more or less a combination of. What I'm very happy to say about the clinic is that we have therapists that are specialized in all these different domains. Besides that, myself and another colleague work extensively with hypnosis. Hypnosis is a medical approach now. It is no longer categorized as a complementary approach. It is considered medical. Of course, I do training of other doctors to do medical hypnosis, being the president of the Swiss Institute of French-speaking therapists for hypnosis. We also, in the complementary approaches, we have EMDR, which is very often used in other clinics, but we have that also. We have, I can't go through the exhaustive list right now, but we have, for example, Tai Chi, Qigong, Pilates, acupuncture, acupressure, somatic experiencing. There's reflexology. I think I said sophrology already. There's many different types of complementary approaches that we use for our patients in our body mediation unit, which is called the Body Mind Source, which is a medicalized spa, if you wish, but with 4 therapy rooms, a swimming pool, a jacuzzi, and hammam for men and women, and then a fully equipped gym where sports coaches and life coaches come in to guide patients in defining their body again and getting back into shape. That leads to your question also about the holistic approach that we use. It's a holistic approach, a pluridisciplinary and multidisciplinary approach where we see the patient from many different angles. And twice a day, members of each team or heads of each team meet for the medical meeting in the morning and the pluridisciplinary meeting in the afternoon to discuss the patient's progress, to see how we can tweak his treatment or ameliorate it so it's more adapted and tailored to his specific needs.
So next question, what is the role of behavioral therapy in addiction and mental health recovery?
Okay, that's rather easy to answer. You just take the basic definition of behavioral therapy. Behavioral therapy has the basic hypothesis that a mental illness is an incorrectly learned behavior. That is, as a child, adolescent, young adult, you've learned how to fend for yourself and survive in society, and what you have learned is wrong. It's a pathology. And so what our idea is in behavioral therapy is to teach you that what you've learned is wrong, and you can unlearn that or de-learn it if you wish, and learn new, more adapted behaviors to reality and to keep your body and mind in a healthy state. For example, someone that's learned that alcohol lowers anxiety, gives them confidence to talk in public, when they start realizing that they're starting to have problems with their liver, they're having problems focusing, they're starting to feel depressed, we can say, okay, that was a resource maybe that you had at the time that lowered your anxiety, but unfortunately it was a quick fix because the long-term consequences is a degradation of your health. So we teach them how to unlearn drinking, for example, through the 12 steps, which teaches you that alcoholism is an illness and you have to stop drinking to be healthy in life. And then we teach them healthier behaviors, such as going to the Alcoholics Anonymous community meetings, to seeing a psychotherapist, to seeing a GP specialized in addictology. These things you don't spontaneously do. We have to reteach the patient how to do healthy behaviors and to find something to replace the void of, for example, the alcohol that's gone after you've become abstinent, so you have a higher risk of relapse. If you develop, for example, passions in sports or passions in philanthropy, other things that you can do instead of drinking that will lower the risk of relapsing, and that is a new learned behavior. That's essentially what cognitive behavioral therapy does. The cognitive part is trying to understand the cognitions that lead to the learning of the pathological behavior. Of course, I'm being very, I'm simplifying the explanation of this treatment, and then learning how to do other behaviors that are healthier in life and more adapted to your situation.
Mhm. So it means that patients with dual diagnoses like mental health addiction can receive treatment same time. Perfect.
Exactly.
How do alternative therapies like art therapy, equine-assisted therapy, and hypnosis support recovery? But I guess you reply this question.
Yeah, that comes back to what I just said. It's to fill the void left
Yes, yes.
by the addictive behavior or the pathology that they're no longer indulging in. They indulge in something else, but that's healthy.
Mhm. How important is family involvement in a patient's healing process?
For me, it's primordial. And
Mhm.
for a typical 28-day stay of a patient here, the third week, we propose, for example, 3 times a week, Monday, Wednesday, Friday, that we have family sessions where if the patient's local or the family can easily displace themselves, we have the meetings here where they stay in a hotel and they come up for the meetings where we
Mhm.
discuss with the patient and all the repercussions in the family, not pointing our finger at the patient, of course, but seeing that the family is an entity also that is ill, that is suffering from a disease, usually codependency with addictions, but we try and see how we can help the family get something started where they maintain bi-monthly or monthly meetings for 6 months to a year on an outpatient basis to help all the suffering that's been spread out into the family from the patient that is the designated person to express suffering, perhaps in something that's happened generations ago in a family.
Okay.
So it's
How,
primordial for me.
okay. How long does a full recovery program usually take?
So if you wish, just to take a typical example of alcohol, a patient coming in with only alcohol, not comorbidities, which you can add 2 to 3 weeks or longer depending, but a standard treatment would be 28 days where they're detoxed. At the end of their detox, they already start their therapies. In the middle of their stay, we look into the most important thing that is called aftercare,
Uh-huh.
where the aftercare specialists come in and say, okay, you're going to be leaving the clinic in 2 weeks. Do you have a psychiatrist, a GP specialized in addiction? Do you have a psychotherapist? Do you have a life coach? Do you have a sports coach? Do you have a personal chef? Do you have a dietitian that follows you regularly to make sure that you're eating correctly? That's one thing I didn't mention previously. We have a dietitian that works with our journalist and our 5-star French chef to make
Mhm.
sure that all the food is healthy and adapted to getting the patient into good health again, but at the same time, that tastes very good. So
Mhm.
the aftercare person will look into this whole network and see what we can set up at home around the patient where they have all their therapies and continued care. When the
Mhm.
patient leaves our clinic, on the average, the therapist, myself, or the aftercare coordinator will give the patient a call on week 1, week 2, week 3, week 4, month 3, month 6, and at 1 year to see if they're still on track. If
Mhm.
patients relapse, of course, they're invited to come back right away to pick up things from the beginning and work on finding the solution that will more efficiently. And this usually happens if a patient refuses aftercare. They say, no, I don't need aftercare. I'm detoxed. I'm fine. We say, sir, we don't agree. You need the aftercare. They usually come back saying, you were right. Oh,
Mhm.
well. Yeah. So if patients relapse in that year that follows, they're invited to come back. And another thing that is part of our aftercare plan is that patients can request a second hospitalization that's called a booster stay, which is on the average 3 to 6 months later, where they do a week to 10-day stay to go through the therapies to benefit from the body, mind, source spa care, to benefit from the outings, where we have, as I said, art therapy, ceramics at
Yes.
workshop, equine-assisted therapy in a farm in the Freiburg Alps, not too far from here. We have all these things, and they can go through all that again and just enjoy the therapies again and find this place that has become a sort of sanctuary for them. And at the same time, they can share with other patients that have just arrived what it's like to be sober or
Mhm.
free of depression or free of anxiety. And for the patients that just arrive that are usually in a dire state, that gives them hope and a light at the end of the tunnel. So that's already a very good thing that the patient coming back does. But
Mhm.
what we explain to them also is that just the act of coming back and sharing what life is like being sober, that reinforces their own sobriety or recovery, saying where they feel, I never want to go back there again.
Mm-hmm.
And we have patients that come back sometimes every year just for a short booster stay. We have patients that come back for testimonies to say, this is what life is like without addiction. Look at me. I'm no longer depressed. And that does help a lot of our patients. And they do it. They start to realize I'm doing this because it's also helping me.
Georges, what are the signs that someone needs urgent mental health intervention?
Well, the main signs I would say is a feeling that something's off, where you're
Mm-hmm.
not able to function at work or in family or in leisure, where you realize that you're starting to have dark thoughts, or
Mm-hmm.
you're not able to do things physically as you used to be able to do. If
Mm-hmm.
you have moments of crying, anxiety that you can't explain, insomnia, if
Mm-hmm.
people around you, if you think things are fine, on the
Mm-hmm.
other hand, but people around you start saying, hey, listen, things aren't going at work, or your wife starts complaining, your husband starts complaining, why are you doing this? Oh, this is
Mm-hmm.
destroying our couple, but you think everything's fine. That's where also it's more difficult, but you should say, oh, something's up. Maybe I should see a specialist or go to a clinic.
Mm-hmm.
That's just Clinique Les Alpes.
Understood. How do you ensure privacy and confidentiality for high-profile patients?
So all patients do sign a document making them understand that legally they cannot disclose information of people who have come in, or they could have problems afterwards. At any rate, that's never really been an issue here. Patients are very respectful. And of course, our whole team is sworn to medical and professional secrecy. Otherwise, the clinic is on a pinnacle of a small mountaintop with a 2.5 to 3 meter fence all the way around it with cameras. And we're watching very often to make sure that paparazzis don't hang around, or drug dealers who want to bring stuff in for patients. Everything is secured, and there's no way to get in or out without permission of the team. Patients are able to leave the clinic after the third week of hospitalization if they are accompanied by a loved one.
Mm-hmm.
And then after that, they can come go as they wish, but they understand that they can't bring anyone in. They have to come in alone. They can't take people where they are at Clinique Les Alpes. And for the first 3 weeks, when patients have outings, they're always accompanied by a nurse, therapist, or other member of our team. They're never out alone.
Mm-hmm. Clear. What advice would you give to someone hesitant about seeking treatment?
Well, the fact that they're hesitating is already a sign of either depression that kind of is, how can we say this, is complacent in remaining depressed. When someone is depressed, when it starts to get bad, they don't want to get out because they don't feel they deserve to get better. That's one of the paradoxical symptoms of depression. You can't get better because you don't deserve that, because of the feelings that are pathological of guilt and shame that you have. And of
Mhm.
course, with addictions, people say, but hey, I'm fine. I don't need any help. And then when they start realizing that there's problems, they have to say, no, maybe this is part of denial, which is one of the main symptoms of addiction that's very hard to reduce, where patients think they're fine, they drink like everybody else, or everybody else takes drugs, why can't I? Or everyone else is a little overweight, why should I worry about that? While they're at 110 kilograms for 1 meter 55. I mean, people that are obese, but they use that as protection. That's where you have to start saying, no, maybe I do need to seek help. Something's off. When you realize that there's a lowering of the quality of your life in
Mhm.
general, the World Health Organization has a scale that helps determine that. There's a shorter scale and a very long scale. Or just the fact that you're feeling that something is off or not right, or if you're suffering and you realize that people around you aren't suffering as much as you are, that means that something's wrong. And finally, if you think everything's fine, as I said before, but everyone else around you saying, no, things aren't fine, you need treatment.
Mhm. Okay. What exactly is burnout and how is it different from a regular stress or fatigue?
Okay, I already defined that for you. So it's a subtype of depression, and it's
Mm-hmm.
different from stress or uh, fatigue, because you're not able to recuperate. You keep burning the candle at both ends. You lose your reserves, and even though you try to rest to recuperate and go back to work fresh and ready to get into the daily routine, you can't, because you've had a bad night with insomnia, ruminating what you had to do at work that you weren't able to accomplish, and it becomes a vicious cycle where you can't get out of it.
Understood. And what advice would you give to someone who suspects they are experiencing burnout?
What would I give to them?
Now, what advice would you give to
Advice.
someone?
Yeah. So first of all, to see someone on an outpatient basis, and to see first a GP, of course, to see with their doctor
Mhm.
if there's something else going on, because a differential diagnosis of burnout can be thyroid disorder, other endocrine disorders. Anemia can cause burnout. So before consulting a clinic, it is good to just see your GP, who he might say, no, this is more serious. This is burnout. You're going to risk falling into depression. You have to do something now. So the GP is the first person. And of course, to follow his advice, maybe see an outpatient psychiatrist, or if things are already too far gone and you're no longer able to function, there you need inpatient treatment like here at Clinique Les Alpes.
Perfect. That's all questions. Dr. Willis, thank you so much for sharing this valuable insight about mental health, addiction recovery, and the incredible work happening at Clinique Les Alpes. Your expertise and dedication are truly inspiring. To our audience, if your loved one is struggling with mental health challenges or addiction, remember that help is available. Clinique Les Alpes provides world-class treatment with a compassionate, patient-centered approach. For more information, you can visit our website or just text us on WhatsApp. And if you have any questions, don't forget we are here to support you on your health journey. And don't forget to share this with someone who might need support.